How are you coping with stress that is there in this life? That is why this week we want to engage on mental health and looking at, are you okay? That is the question we are asking. How are you coping? How are you feeling? How are you emotionally, physically, and socially also? So this week we are looking at mental health. This is Phyllis. Welcome to our YouTube channel at Phyllis Shiko, Moses Basket Initiative in all our social media platform, so that we can be able to learn this week on how we can look at our mental health and why we need to look at how we feel and how we think and how, because without proper or good mental health, you're not able to function properly. That is why you need to relax, enjoy this discussion so that you can ask questions on our DM. You can ask us through our DMs. You can get our number there and you can be able to move if you have an issue with your mental health. It doesn't mean that everybody in this world needs to take medicine so that you can be able to have proper medical mental health assessment. No, there are other ways you can assess your mental health yourself. Are you sleeping well? Are you restless? Are you okay? Are you overthinking? Are you isolating yourself from other people? Those are things, that indicators that will tell you how your mental state are. And that is why I keep saying every time that people need to look at their mental health from a very young age. It's every stage of our life, our developmental stages as human beings, that we are able to look at our way of our mental health state at every angle. Let's look at a small child who is born between 0 to 11 years from birth. Let's say not 0, but we say birth to 11 years. Then we are talking about how is the child developing. Are they reaching their own milestones on time? Are they coping, or are they able to do what other kids are doing at that age? Then we can say this child is ready and is mentally healthy, and therefore they are able to move to the next stage. But if they're not reaching their milestones, they have delayed milestones, then we start looking at how is their mental state and what is contributing, so that you can be able to learn about their mental states at a very early age. Then we come to the adolescents. We want to see this adolescent, how are they coping with their bodily changes. Remember, they are changing, the body is changing, they are experiencing different types of changes in their body, and the mood, we want to check on their moods. Some of you complain that the kids close their doors behind you and all that. So all that is also stressful for them, because they are starting to understand themselves in one way or the other, and these changes in their body are mixing them up. So you'll start hearing another one saying, oh, I'm not a boy, I'm a girl, and yet he's a boy. I don't know, I'm feeling this way, I'm too tiny. Others say I'm too fat, I need to shed weight, and they get themselves to nausea and not eating so that they can be tiny. So all those, then we need to talk about it and understand that the mental health of that teenager is important to us. So when at that stage again, you come to the young adults again, we want to look at their mental health well-being. You remember, we are looking at their happiness, we are looking at, are they able to operate normally, duties, they don't have scored duties, they're excited about life, they're excited about facing tomorrow, and despite everything else. So in the young adults, we want to look at, are they able to cope with their campus life? Because these are kids or young adults who are joining campus, or they are joining colleges, different, or polytechnics. So we want to look at how are they coping with their friends, how are they coping with their relationship, which kind of relations are they in, are they looking for people who are in church or are in the mosque, or are they clubbing with others? So you categorize those kids in that direction. So you see others are Catholic, others are SDS. Where are they likely to go? Or are they just with friends who are clubbing? So their mental states also will tell us at that stage. So which they have to make choices for their life. Which career do they want to take? Which friends do they want to keep? And how do they want to operate their lives? Because remember, this is the time we talked about last time, and said they're exiting, it's at their departing stage from their parents. So how is their mental health when they are leaving your house? That is very important. What kind of moral values have you instilled in them, so that when we are looking or assessing their mental health, we can say this is a young adult who has proper or is experiencing normal mental health wellness, and they are okay and they can be able to run on themselves independently. Then we look at another stage of people. These are people now we call the middle-aged, not aged, but age, that this is between now 24 or 30 to 40 to 45 there. They are not age, but they are just there in their middle life. So what are we talking about them? They are looking at marriage, they're looking at raising children, they're looking at their job careers, they are working in different, maybe self-employed or they're employed. How is their mental state? How are they able to juggle all this responsibility at once? So you remember, these can be stressors in their lives. So we want also to know how are they, and that is why I keep telling you, when you meet people, ask them, how are you, how are you feeling? Greet somebody, be nice to a person, because it doesn't hurt anybody to be just nice to anybody. So just be nice and cope with them in your workplace. Look at them, ask them, how are you doing? Is there an assignment I can help you? If it's a mother, a working mother, how are your children? And how are the children? How are you coping with the children and work? Everything. And also marriage on the other side. So all these are the middle life people that are going also through different stressors in their life. Then we come here, then we look at, oh my goodness, we are getting the older people at this stage, that is between 55 and beyond. So these people are looking at their children have gone and the house is lonely. So they're experiencing loneliness. They're experiencing a lot of loneliness. That means that they're not able to put themselves together, and they feel like the world is empty. Some of them start feeling like I should die today. Some are very sickly. Some of them feel like the world has come to an end because maybe they have not achieved much in their life. They are still living in a small house. They are still living in a small place. They are still struggling with basic shelter, food, and everything. They still have to work at 64, 65, 70, and all that is a stressor. And the loneliness is the most of it. So we also want to look at their mental health well-being. So that's why I say it is important for all of us to check on one another, because sometimes just that high can change the perspective of somebody. Somebody can say, oh, there's somebody who cares about me. So we are looking at how happy can you be. We are looking at you being just a normal person who is able to operate in the right manner. We want to walk with you in this journey and say, okay, fine, these are the stressors, but you can be happy again, and you can be able to operate in this manner in the right ways. So sometimes when we look at the human being, we can look at the human development process, and we can say that, okay, this person went through all the development stages well, and this person is a complete human being. Remember, even if they are complete, it means there are small stressors here and there that are keeping them awake all night. So there are things that you need to look at, as in the beginning of the video. Are you restless? Are you okay? Are you overwhelmed? Do you run away from things? Do you close yourself inside the house? Those are the things you should look at. If they are on an extreme level, then we'll talk about that these things are disturbing you in life. So we need you to be okay with your mental health, and you need to be checked. And I keep saying every time, it doesn't mean that you are crazy or you are a mad person, so that is why you are visiting a mental health hospital. No, it is important for you to visit, for you to just get that assessment, and for you to know your mental health abilities and say, okay, I am fine, I'm still in the right track. Because you never know what is causing you all this. Last time we talked about the traumas we are going through and the childhood diversities that we have experienced that are causing us to have these mental health issues at the end of the day. So life is not easy, and life teaches people many things. And if you're in that process, you need to know that life has to take a different direction. And the best thing for you to be able to cope with this life as we are going on is, are you okay mentally? Are you okay? Are you shouting too much at work? Are you agitated? Are you irritated too much when somebody is doing something or somebody is talking? Are you okay with somebody else taking over? Are you the right kind of person who doesn't know how to delegate duties, and now the duties are killing you properly? So we need to look at all these things in these different perspectives so that we can know What is stressing you? What is this bringing this irritation? Why are you aggressive towards other people? Maybe somebody has not even done anything to you, but you're already judging them, and you're too aggressive with your behavior to be able to judge them quickly and shun, call people names which are very ugly names, and it doesn't suit you. It means there is a problem somewhere, and you need a medical or a mental health checkup, so that we can be able to know where are we starting with you. You can seek therapy, you can seek counseling services, so that you can start healing. We say when you talk to somebody, then your healing process starts. But as long as you are not talking to anybody and you don't want to address the issues that are there in your marriage, if you don't want to address the issues in your relationships, if you don't want to address the issues with your children, and you don't want to talk to anybody that, oh, my children are really stressing me out, and really my children are not taking the right direction, and I need help. First, I keep saying, you yourself, you have to speak to yourself and say, I need help, because there's nobody else who will help you if you don't first of all, accept that you need help and you need somebody to walk with you this journey, because life is long and life is not there for you to wait for you. It just keeps moving, and you realize you're 70, you're 80, and you're starting to deal with your old age crisis, which is now another level of it. So before we go to all that and we bury you in at an early age, or we are facing somebody going crazy just because you did not, you were not able to open up because you feel ashamed, you feel your self-worth is going down, you don't have the self-confidence, you hate yourself, you don't want to approach people. Help is very important. Help is just closer to you. It's only you who is not closer to the help. There are many other people. You can work with counselors, you can work with therapists, you can work with even with friends. You can have good friends, good support system. What is your social support system? Who is that person who is supporting you? Then we are able to see that you get help in one way or the other. So you need to realize that life, you cannot do life alone. Life is about all of us, because I said mental health is also about the social well-being. How are you operating with other people? So if you are isolating yourself from the weddings, your burials, you don't want to attend the chamas, you don't want to attend a birthday party somewhere, you just want to be within, people are reaching you out and they can't get you through. So those are all things that we are talking about every day, that these are the stressors in life that you need to address before you get to depression, before you get to anxiety, before you get to mood changes, before you face all those categories of stressors. You need to understand yourself first. So once you start with yourself, then we can move to the next person. So don't just point at other people. This is the person who is bringing problems to me. Don't be a blaming person. You blame, you put people responsible for your own behavior. Therefore, as you look at your own issues and as you look as you assess yourself, one thing we need to know is that we are here for you as Moses Basket Initiative. Reach out to us so that we can be able to walk with you this journey. So don't fear, don't feel ashamed. Just call and DM us so that we can be able to work together. Follow our YouTube channel. Make sure you subscribe to our YouTube channel so that we can move together. And if you have subscribed, we appreciate so much for being our community. And make sure you look for us in all our social media platforms. You're going to get us there at Moses Basket Initiative. YouTube